That red hat. I thought it was a Donald Trump MAGA hat at first.
Can you hear me?
I can hear you. Can you hear him, Benny?
Yeah, I will. I'll turn it.
All right.
I'm gonna go.
Dr. Barksdale.
Well, Senator Brown, I'm a working man.
I know. I'm Sherrod Brown. Welcome to Facebook Live. I'm joined today by Dr. Edward Barksdale, Surgeon in Chief at University Hospitals Rainbow Babies and Children in my hometown of Cleveland. Decades after we learned of the dangers of lead exposure, too many Ohio children are still being poisoned in the homes they live in and the water they drink, sometimes in the soil that small children play in. In 2018, some 3,800 Ohio kids tested positive for high lead levels. And while that's the data we have, we know that there are many, many more children who are at risk who've never gotten tested. Many Ohio families only learned that their children had been exposed to toxic levels of lead after they began to experience symptoms. We know how serious a health threat lead contamination is for small children. Lead poisoning can lead to decreased cognitive performance, to weight loss, to delayed growth. Children under age 6 are at the greatest risk. We need to do more to prevent lead poisoning in the first place. We need more testing to diagnose lead poisoning as early as possible, really at the age of 1 and 2. Early detection is the key to getting kids the treatment they need to avoid the worst long-term health outcomes. That's why I joined a bipartisan group of my colleagues, including Senator Portman, to introduce the Preventing Lead Poisoning Act, ensuring that children enrolled in Medicare or enrolled in CHIP, the Children's Health Insurance Program, are tested. Right now, only about a third of kids on Medicaid get that screening. Not only does testing ensure that children get the follow-up care they need, it also helps us identify and remove lead hazards when we find them. The best way to protect our kids is to prevent lead poisoning before it happens. According to the Housing Finance Agency in Columbus, more than 2/3 of homes in Ohio are old enough to contain at least some lead-based paint. We know it's not just urban, it's not just suburban, it's not just rural, it's everywhere. We remember what happened in the town of Sebring, a small town outside of Youngstown a few years ago. In Toledo last week, the mayor talked about how as many as 3,000 of the city's private water lines have lead in them. The city estimates it'll cost $60 million to replace them. That's why we need a transformative infrastructure investment to put Ohioans back to work, to make our homes safer and our neighborhoods safer, and to make transportation better, to help children grow up with more opportunity. No parent should ever have to worry that their children are being poisoned in their home by the soil outside their homes. I'll stop there and turn things over to my friend, Dr. Barksdale of University Hospital. Welcome.
Thank you. Senator Brown, it's so nice to see you again. I appreciate this opportunity to join you today. It is an honor to speak in support of your efforts to address such important public health issue, especially for us here in Ohio. As you know, as the chief of surgery at Rainbow Babies and Children's Hospital in Cleveland, I witnessed firsthand the devastating impact of lead poisoning on not just the immediate health, but also the long-term well-being of children well into adulthood, the significant impact that this toxin has on the community. Lead poisoning rates here in Cleveland are nearly 4 times the national average, with 40% of Ohio's lead cases 40% of Ohio's lead cases occurring in Cuyahoga County. These effects, as we all know, are irreversible and often combined with other risk factors for children to impair their cognition, their learning, their attention, and their behavior. And these effects last a lifetime, from poor school performance to reliance on public services, decreased professional productivity, and also an increase in criminal behavior. And we know that there is no safe level for lead in children. I applaud these efforts, but while primary prevention of lead poisoning is our ultimate goal, testing of high-risk children at recommended ages is also critically important to prioritize the interventions to prevent further lead exposure in children with elevated blood levels. We identify children who also require medical management for these high levels, and we connect these children to important services for their healthy development. And we feel strongly here at Rainbow, as in other hospitals in the region, that connecting every child to a medical home allows for not only the detection of lead poisoning, but also the education of families of how to impact their environment and to improve the performance of their children in all aspects of health. 40 years ago, this summer at this time, I was a first-year Harvard medical student who was doing lead abatements in Boston, working with the Boston Housing Authority and also working with a neighborhood community health center to go in homes and identify lead. And I saw at that time that lead poisoning is a public health crisis that also has a housing solution. I also learned that there's lead not only present within the paint, but in certain environments present within the soil. And it's necessary for us to remediate these lead hazards in housing, infrastructure, in the environment, and that can have a tremendous return on investment. And certain results show that return for every dollar invested may come back at 17 to 200 times the ROI. So as I close, I applaud you again, Senator Brown, for these efforts. We appreciate you drawing the attention to the important access to lead testing for children and for your support in preventing lead exposure in the critical pediatric population. Thank you.
Thank you, Dr. Barksdale. Dr. Barksdale practiced before he came to Ohio a little more than a decade, well, about 14 years ago, practiced at the University of Pittsburgh Medical Center, and he is such a great addition to one of the great hospitals in the Midwest, the University Hospital Rainbow Babies and Children. He's surgeon in chief there. This is such an important public health issue. It makes such a difference in the future of so many of our children in our country. So thank you, Dr. Barksdale. Thank you for joining us all on Facebook Live. Thanks.